Good afternoon, sir. Good afternoon, ma'am. My name is Snehal Sadashiv Bhagwat. And my group members are Miss Prajakta Deshmukh, Navnath Jogdan, and Sangre. We will give a short presentation of coronavirus in India. Okay, next slide, please. Our presentation is divided into following parts. Firstly, an introduction, then methodology, then survey, then literature survey, methodology, applications, advantages, and reference. Okay, let's move on our first slide, the introduction part. Coronavirus pandemic firstly seen in peoples of China in Wuhan. So it was an infectious disease. About the disease and situation of the COVID-19. So when people were know about the disease, they were scaring and no one can go or helping around them. So in that situation, we observe or notice one thing, that we need a super specialist machine or a robot to serve food or medicine to patients or interact with them. Okay, so we are on mission to create super specialist machine which is able to perform like functions like an human being. Prajakta will continue the next slide.
Okay. Problem statement. The problem statement is that health sector has always faced a shortage of doctor, and this COVID times we have a witnessed shortage of doctors. The main objective of the project is design and implement a biomedical based medical assistant robot to deal with this problem. Next slide, please. Aim to develop a medical assistant robot designed for the patient in need when there is shortage of doctor. Objective to deliver contactless sanitizer to people, to detect temperature of different people, to check ECG parameter. Last one, to contact with patient through camera to deliver medicine to patient. Continue with Sanket.
Now we can see methodology. In a methodology, we do three stages. Uh, Now next we can see a block diagram of our project. In a block diagram, we shortly present which components are used in our project and how control the project uh, through mobile app. This is our project block diagram. Uh, this is a physically used component in our project. LM35, L29 3D. It is a motor driver, and Max 3000. It is a heartbeat pulse oximeter, not MCU. It is open platform and camera. So first component is LM35. It is a temperature sensor. It is sense temperature and show on display. Uh, Show on display. Next, LM35 3D. It is a motor driver. In our project, use three motors like LM35. It is a oximeter. It is a oximeter. It is heart rate pulse meter. It is heart pulse oximeter. Sir. Next one is a node MCU. It is an open platform. All components are. Next part is hand over to Navnath.
Yeah, its application is it can be used in hospital. It can be used the respective task. It can be used in quarantine areas like in COVID areas like uh, contactless food delivery to patient and supply the medicine. Boring and unpleasant tasks like it can be used in residential and commercial use. Commercial also we can use in also commercial use. Advantages are is break the chain in initiate because of the COVID-19. We are this virus is like we can touch the person to person and it can be spread. So that's why break the chain initiate. Especially facility of receiving Viva charging, contactless medical facilities, did not come to directly in contact with patients, encouraging the use of robots to support and social distancing. Robots can be work and other environment, and it can be used in military purpose also. Robot need environment comfort and protect yourself from COVID-19 situations. Like uh, it's mainly used in COVID-19. These are the advantages. Conclusion in this project, we have presented robot for serving food or medicine to patients who are suffering from COVID-19. This robot helps to doctor to avoid direct contact with the patients. In practice, digitization and automation did not progress fast before 2020 due to multiple reasons. The cost of robot is high and implementation is resisting against the cheap labor. In this work, the achievement of the robotics research during the pandemic is reviewed and discussed to answer the literature for analyze waste and supporting technologies, while TRL is defined the future research trends to essential techniques are also addressing, including AI, 5G, big data, wireless sensor network, HRC, and haptic control to answer architecture. That's it. Yeah, these are the references. Next slide, please. Thank you.